See if any of these symptoms sound familiar. Fatigue, weakness, depression, diminished sex drive. They're not necessarily signs of aging. Therapies are available now that can make a big difference in how you feel, like testosterone replacement at Omaha TRT Institute. Dr. Jeffrey Passer and Dr. Daniel Gross return alongside Gabe Sullivan. It's nice to have all three of you back on the show. You've been here before. Today we're going to talk about supplements and then a few forms of therapy, including HGH. What is that, Dr. Passer?
HGH stands for human growth hormone, which is a hormone made in the pituitary part of the brain that is originally associated with growth in children, so that's how it's got its name, is growth hormone. It really should be called human repair and maintenance hormone, because that's what it does in adults.
And in what way? How does it affect a patient who comes in with maybe one of the symptoms that I outlined in the beginning? How does it help to correct some of those concerns?
Well, when we test for growth hormone, you actually measure a different protein called IGF-1 because it's more stable in the blood. But if your levels are low, it actually relates to premature aging, and correction of that deficit can help skin, muscle, decrease fat, increase healing, the immune system, the heart, the brain. So it's even been used to help post-traumatic concussion syndrome.
Far-reaching benefits with that therapy. Who's a good candidate, Dr. Gross?
You know, anybody that is looking to maintain their health, and anybody that feels signs that symptoms of aging and slowing down, and people that are looking to lose body fat, maintain or increase lean muscle, people that are concerned with the bone density and just overall health.
One of the other concerns that for women and men alike, that as we get older, you gain weight and you can't always lose it like you could when you were younger.
Indeed.
So what can you do for patients who are looking to lose weight specifically?
Well, in addition, we just have a number of really positive interventions, and in addition to testosterone replacement and HGH therapies, we have a weight loss clinic that uses benefits of HCG, which is different from HGH. It's human chorionic gonadotropin, but that can really help lose lose fat while maintaining your lean muscle, and along with a diet that is directed by one of our weight loss specialists, can just be very beneficial for patients. It's been very successful.
Some of your reviews online that I've read speak to that, and the results that people have seen. That's where there's a lot of satisfaction, but it's because of the comprehensive nature of the program.
Absolutely.
The people aren't on their own. They feel like the support system is in place, and you're evaluating sort of the chemistry of their body to get to that goal.
Absolutely.
Dr. Passer, you brought some supplements in here. How do products like these fit into what you're doing at Omaha TRT?
Well, I like to use supplements in persons who have specific reasons or needs for them. People come in with a bag full of supplements, and I say, "What are you taking these for?" And they say, "I don't know. I just went to the health food store and they gave me all these things to
The
take."
label looked good, I guess.
The label looks good, but you have to be careful with supplements because they can, one, interact with your medications, and two, they're not as highly purified and regulated as FDA drugs, so you have to have a good company manufacture them. So we vet the companies we use and make sure that these are good products. They can be used for adrenal fatigue, tiredness, increased nitric oxide production, which is related to erectile function in men and cardiac function in men and women, because your nitric oxide levels decrease as you get older. And just a good general vitamin and mineral for support. There's also a product there called TA65 that has been around for 10 years. That's a very interesting product that increases an enzyme in your cells called telomerase. And on the ends of your chromosomes are like little caps, like on your shoelaces, the little plastic ends. Every time the cell divides, those little plastic ends get smaller and smaller. And until they get too small, the cells don't divide and you die. So you can measure telomerase.
Dr. Passer,
length.
I want no part of that.
And this is a supplement that has been shown to increase your telomere length. So
wow. Well,
it's pretty interesting.
This is their specialty. I mean, that's almost an understatement. Gabe, one of the questions that people have naturally is about cost and insurance. And yes, I'd like to solve some of these problems, but how am I going to pay for it? That's something that you take seriously.
It is, yeah, and you know, as far as the testing, a lot of times we can get the insurance companies to work with us. The testing is now some of the supplements you see here. Insurance companies, unfortunately, they look at it as an elective, so they don't cover that. But I can tell you that our pricing is very competitive, and we'll work with it.
Well, and that's one of the things you can talk to them about when you call and schedule an appointment. And I know we have a lot of gals who watch, and they, right, the men in their lives, they think, boy, let's do something about this. This has been going on for a couple of years. There's no point in just dealing with it, especially with so many options available. You're welcome to call 402-391-3800 to see Dr. Passer or Dr. Gross. Gabe is there at the office as well, and then they've got a whole support team there to help you with whatever goals you might have. Gentlemen, thanks so much for joining us.
Thank you.
Good to see you. Well, Mike told